Okay. Hello, everyone. Hi, Emma. We have Carlos back.
Representing Katie.
Truly so representing medical affairs today, Carlos.
That's a different picture of me in the past.
Fantastic. Should we do a quick intro from our side for the audience who I know by now definitely know Carlos? But
I was just that guy rambling before.
Emma?
Hi, I'm Emma Vitalini. I'm the head of Global Medical Digital Strategy at Amgen.
I'm Zeinab, Sulaiman. I lead the Medical Affairs Center of Excellence at Sorcero, and I come from over 10 years of experience in-house as an in-house medic, one of the unicorns that Carlos has been referring to over the course of today. And today we're going to be speaking about whether AI is the missing link where it comes to implementing omnichannel for medical affairs. We're going to start by tackling the elephant in the room and talking about why the word omnichannel actually makes so many medics uncomfortable. Carlos will have an opinion on that. We're going to ask you to share it.
It's not that it's making medics uncomfortable. I think it's just an overly used word that served the great excuse for investments and sales of solutions without an actual understanding on, first of all, whether customers need it, and the second on how do we do it, and the third is do we have the capabilities or the content to serve it. And I could say, over all the years, I've never met a physician who came and told me, I love your omnichannel, or share with me your omnichannel strategy, or where is your omnichannel content? I'm not sure they even know what it means.
For sure, I mean, we don't expect them to know what it means, but we have to. Would you say that the way our customers are now consuming content has changed in the same way that the way we've consumed content's changed, right? Like, I don't necessarily just want to have face-to-face meetings anymore. I'd like to be able to consume some content either through digital channels or social media or just other channels that I interact with day to day. Would you say that's also the same trend that we're seeing?
That's multi-channel. Honestly, I'm wrong, and I'm happy to have these conversations later, but I'm a strong believer that omnichannel doesn't exist, or maybe people are just confusing it with multi-channel. I've had meetings where people would come and say, I want to share with you our omnichannel strategy, and I say, okay, what's your omnichannel strategy? We have slide decks for the MSLs, we have the slide decks for the sales reps, we have updated their material, we're going to throw in MTEs, RTEs, and we're going to have an HCP portal. Great, that's a bunch of push. That's multi-channel. That's not omni-channel.
Do you think medical needs omni-channel, Emma?
I think we are also abandoning the kind of concept of omni-channel and looking at instead, we're not looking at a concept that mimics what commercial or the commercial interpretation. And I think in general, in pharma, we're not doing omnichannel. I think, Amazon does omnichannel, and, Andreas sort of showed us the investment that was put into Amazon. We're not going there. Interestingly, Amgen's just hired somebody who was in charge at Nike and brings a lot of this experience. So we're going to see what that's going to bring to us as a company. But really, we're not creating that experience. What we're trying to do, and what we've sort of tried to instill into the teams, is we're looking at creating that connected experience. So we're not looking at omnichannel per se, but we're building an engagement journey that's not just a siloed activity, whereby, as you just described in your last one, we have like 40 sort of objectives or meetings or tactics that we need to execute on, and we just do boom, 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 boom. Well, actually, no, we want to bring that physician, that customer, whoever it is, on a journey with us, and we will use different types of engagement in order to connect that, and in some ways prolong that engagement, because we don't want it just to be this one-off communication. But again, it's probably more multi-channel and not really truly omni-channel.
No, I completely agree. And that, I think, is it's a good example of generally how most medical affairs teams that I've come across, and I'm sure that same as your experience, are going about trying to embrace digital communication with their customers, right? And it makes me wonder if medical affairs does need to have its own very distinct digital identity where it comes to engaging customers, and whether multi-channel or omni-channel or whatever buzzword you want to throw out there, it's just a buzzword. And we actually just have to figure out what do our HCPs and customers need from us as medics, and how do we best create that. Thinking about really creating that distinct digital identity for medical affairs, and perhaps learning from other industries like outside of pharma, but also our commercial colleagues. How do we combine the best of everything we've seen to actually enable medical affairs to start that journey and become more effective? Whoever wants to go first.
We have gone on that journey, and so we have a concept that's called always on. And our always on concept is that whenever somebody wants that information, that they can always access it. And we're trying to transform the way we're delivering that, and it not just being, us when we're pushing that we think you want this message at this time, but we're trying to make sure that when they want to pull it also, it's available for them in unique ways. And also that they see us as this partner of choice for that information, because they see this additional value we're bringing, or additional ways that they can identify the information they want.
That's really helpful. And Carlos, how do we maintain scientific credibility while delivering this, so that we don't just become another channel that, like, from pharma that's pushing messages for the sake of it, but we remain that credible peer, scientific peer that our HCPs and KOLs want to hear from?
Yeah, so we do know from research that doctors prefer interacting with MSLs, and we've seen the presentation earlier today, but we still do the opposite, right? Doctors do not like HCP portals, and they prefer credible sources like Medscape or other, but we still push HCP portals. Doctors prefer maybe MTEs that might be a bit more credible, and they have data on late-breaking science versus RTEs, but we still push more RTEs. So, I mean, what's more to say, right? So, unfortunately, in pharma, sometimes there's an agenda that needs to be followed, and the agenda is our agenda and not the HCP's agenda. So I think when we start following a bit the HCP agenda and really addressing through proper insights what their needs are, then we will see that they look at us as more credible partners, because we're helping them rather than overloading them with things that they didn't ask for.
Completely agree. Anything to add?
Yeah, no, I would agree. I mean, we're facing the point where, and it was mentioned, I think, in the previous panel, people are becoming passive because there's so much of information that's being thrown at them by every different company, and we all think we are valuable to them. I think there needs to be transformation above the pharma level. We need someone to come in that's going to disrupt the system, and maybe bring in a platform that allows all pharma companies to plug and play into, that actually sits within the physician's workflow. Because to your point, at the moment we just try and pull them where they want, and we're not actually supporting them.
No, I agree. And I also agree with your earlier comment that we're not quite the Amazon or the Facebook or Instagrams of this world, and we just can't be there. We just can't be those providers. But given the changes within our industry with the use of AI and the applications of AI, and how AI is actually helping us better analyze the digital footprint of how to identify HCP information need, do you think that can help us in the way we better identify and HCP needs and make this more HCP-centric? How do you see
I mean, of course, the technology, it's a no-brainer that the technology is going to help us identify more about how HCPs would like to interact, what sort of material would they prefer, is it bite-sized, is it that they are the type of HCPs that would like to go into the details and the p-value of the p-value, or you have ones that are more visual, they would prefer a diagram of the data being shown, and then you tailor these data, and either you equip your MSLs with it, or your MT, or whatever sort of information the doctor, or in the format the doctor would like. You still have doctors that use flip phones, so I don't know how they would receive a message on a flip phone, but you have also the advanced doctors that would love to receive digital content that they could use maybe with their patients in their presentations, or even in their discussions. So any technology that will help us understand the customers better and kind of deviate us from our own fixated agendas, that would be great.
Emma?
Agree, and I think, it's going beyond that and understanding also who's important that we didn't realize was important. So some of the work that I've done in the past has looked at identifying the relationships between people that are maybe of interest to you. So they may be decision makers. And actually, if you look at the connected network that they have, are you engaging with those? Because otherwise, this decision maker is not going to be informed by any of the people that they trust about your product, your development program, anything. And these are the things that, I know it's been discussed a few times, we can do everything that AI can do. Absolutely. But not all of these things. We don't think to look for these hidden connections. And that's where I think AI can transform the way that we're engaging, the way that we're prioritizing who we're seeing. And so, yes, there is the opportunity.
That's a really good example. And there's so many examples, to your point, of kind of much more advanced influence mapping. We heard from some of the presenters today about all the different ways that AI can be used to either map KOLs, influence mapping, to your point, content consumption habits and how they want to really better receive and consume content. And medical affairs is sitting on a lot of this data, right? We do have access to a lot of data points that we could use to inform these decisions. How well do you guys see the data currently being utilized either by AI or manually to inform how we go about customer engagement?
Limited. I think we've been trying to push, but there are different reasons why. Some of it is that the foundation isn't there. So again, back to that investment with Amazon, they really sort of invested in their data layer. We do have a dedicated data lake for medical. We're probably one of the few companies that's really invested in this. But we still put data in there that we don't use and don't look at. So we have hundreds of sites that we uncovered that I've taken ownership of and now no longer. But I mean, we were sort of getting metrics from Cardinal Path, from Google Analytics, and not really doing anything about it. So we were sort of generating this information and no one was looking at it and thinking, how do we use that to kind of course correct or inform anything else? Even, as Dario mentioned this morning, sort of, how do you take the decision not to do something? Well, you need to look at this. So I think there is not, and this is a kind of medical part. I mean, we've had a few discussions today that medical and digital shouldn't be separated. It should be together, but traditional medically focused people are interested in clinical data, and people like me are interested in both. And it's not everybody, but you need the balance of both because you need the domain experience to be able to know what to do with it. So it's about sort of investing in those capabilities together and not just having a group in another room that sort of does this but doesn't understand what you're doing and doesn't, they'll just come with you and go, oh, look at this is wonderful. And you'll be like, yeah, but I don't know what to do with it. So you need those people that can translate both. In order to start making more use of the data.
And what you're describing is such a common example across almost every medical affairs team that I work with, and I work with many as part of my new role. And it's exactly the same thing. So much data, abundance of data availability, and just very little being done. Maybe 5% of data is being utilized as part of the day-to-day work. How do we go about changing that way of working, Carlos? Is it a mindset shift? Is it the business acumen that's missing? What would Dr. Plog do in this situation?
Good reference. So to go back to this abundance of data, the thing is that the people don't have time to analyze this data because they're busy collecting data, new data, right? And one thing that someone, I don't know who, is trying to achieve is how can we incorporate Gen AI in terms of putting all that data, and then you can ask that chatbot questions, and then you can get answers from that data that already is existing. And it can only feed on that data and not on the internet or other sources, so that you avoid the hallucinations. So that is one sort of exercise that is being tested, and this will help avoid the multiple market research that every time there's a restructuring, a new team, they do a new market research, and then another team, and then a new market research. So keeping track of those and having a Gen AI manage that could be one of the options. And also for all the clinical trials that are done, usually you have a lot of data from those clinical trials, and if each time you want to do an analysis, you need to get a biostatistician and a medical writer, and then have this time and resources being spent, if you can just get any analysis that you want with a click of a button, this could also look like the future, and I'm sure also other companies are doing that, and we'll hear more about that.
And this sounds like such ideal way to consume data and build business use cases on top of our data availability so you can actually make it actionable. But there still seems to be some challenges in medical affairs really embracing this. Even though this technology exists, to your point, there are companies we heard from this morning that already do this and other companies who do this. And it's an available functionality and use of AI, but there's still perhaps a little bit of resistance towards fully embracing what this can bring to pharma in general, but specifically medical affairs. What 3 advice would you have to pharma leaders, maybe specifically medical affairs leaders, who want to go about embracing this AI technology to make their customer engagements more efficient? Carlos, or Emma?
Do you want to go first?
I'll let you.
I mean, these are all points that we spoke about during the day. So first of all, you need to take them on the journey. Mm-hmm. You need to identify a clear why. Don't come to your medical affairs teams and tell them, you have 1 month to incorporate AI into your work. They have to understand why do we need that and what is the problem that we're trying to solve. Mm. And by solving that problem, what would good look like? Mm. And then you bring your regulatory, your compliance, your legal people along the way with you from the first point, from the day you're deciding to think about this. Mm. You get them involved so that they're with you along the journey and not you create the whole thing and then you face a roadblock. Mm. And then you experiment, you try, you course correct, and then you do it. And then when they see that their job is becoming easier, there are things that are getting better, and also maybe some misconceptions or myth that you demystify. Because maybe medical now think that, if I use Gen AI, it's going to create wrong data, or it's going to come up with wrong claims, or it's going to make me do the job twice. Maybe it's wrong. Have you tried it? And then there are certain things, guardrails that you could have put in place, like limit the source data so that you limit the hallucinations. So there is always a solution, but you just need to have a bit of an open mind and be there to experiment. However, if you're in a company that does not allow this to happen, and it's a very kind of restricted environment where they say that, we love our people to innovate, and then one innovates, fails, he's out the door. So if you're in that sort of company, then I'm sorry, you don't have a solution. Change companies. Change jobs. So, but if you're in a company that allows for you to experiment, to pilot, and then if it fails, you embrace that failure, then hold to that company with your dear life.
Culture of failure is not very big in pharma. And culture of failure is not very big in pharma.
It depends where you work, but generally, yes. We claim it is, but it's not.
It's not. Emma?
Fully agree. Compliance, legal, regulatory privacy from the beginning, it helps you go faster. Get people comfortable right now, as most of us have with ChatGPT or Copilot or versions internally. That's sort of helping them to establish confidence with operational level, then help them to start thinking about strategy. For that, we've established, an intake process where every idea counts, not, but it's more that any sort of solution that's only top-down, 50% of them will fail. So you need the bottom-up perspective and that domain perspective. And then what we've also started to do is use ChatGPT, build your own GPT, have it tell you how to roll it out to specific groups of the organization. So give it the job description, the blueprint, and say, okay, this is what I need to give them. Tell me how I can make it relevant to them. How is it going to solve things for them that I can then make it relevant when I communicate with them? So think about that sort of thing. And to your point, start small, use little parts of the process. Don't go for everything end to end. Break it down incrementally, because people also start to see it's a little bit explainable. It's not fully, but they start to see a little bit how it's enhancing just components. We've also built a lot of trust internally with solutions and pilots first, and now we're looking at our first external kind of chat, AI, generative AI solution. And that's going to be a big deal, because we're actually also going to restrict it a little bit. So we're not going to fully unleash its potential, but we're going to have it help explain content that's existing in a way that people can consume it differently. So instead of reading it, I as a patient can actually, I as a patient,
You mentioned the patient.
can, I as a patient can, call this number and speak to an AI nurse that's going to help me understand it in a better way for me. So I think it's just taking the appropriate risks and not going further, and we're out of time.
Almost out of time. That's really helpful advice. Thank you both. And lastly, I want to ask one more question. Measuring the impact of medical affairs is a topic that's close to my heart, as well as yours, based on what we just heard. How can AI help us better measure the impact of our educational activities and engagements?
Okay, so, no, because I just mentioned that, and I think something I missed in my presentation was that you can measure the impact for contributions, but then how do you measure the patient outcomes? And I think this is where AI could play a role in the future, because we are seeing certain applications or trials of applications of AI in terms of observing patient outcomes or looking into real-world evidence generation or registries and kind of seeing the behavior. So these are all things where you could measure. Now you want to restrict it to education, that's fine. You could use AI through either the insights that you gather post this education or maybe the sentiment that you see on social media or any other notes that you gather or advisory boards. But also you can use the behavioral change. You can look into the practical application of whatever you were trying to teach and the change in behavior in treatment or in therapies and how it moves. And maybe one last word, because I know we're out of time before handing over to Emma. Again, I don't know if I'm the only person hallucinating in this room, but I would love that in the future we talk about education as a pharma job and not medical. We talk about data as a pharma asset and not medical, because I think we are mature enough to know what are the boundaries between commercial and medical and access, and how we can have the proper and appropriate use of data or of education while respecting the barriers and not necessarily remain in those silos and put commercial as really the bad guys that they only want to pay physicians and do bad stuff, and medical we are the saints, because sometimes you might see the opposite.
Completely agree, and thank you for that. Really good examples, Emma.
Well, I would just say, yes, use sort of AI to help you. So find your data set. If you're tied to ICs, if you're tied to a kind of advocacy level, have AI sort of provide you with that information segment, and then have it also map it at the end of the year. Has that changed based on all of these inputs or data sources? So, and just look for other proxies of information and behavioral changes you were mentioning. The ultimate impact on the patient is something we want to achieve, and look for ways to measure that.
Once we unlock the power of data, there's so many different ways to measure general impact of medical affairs. Thank you both so much for your time and for a really interesting discussion. If anyone has any questions or wants to learn more about any of the work that we've done, please feel free to find us during the reception. Thank you, guys.
Thank you.
Thank you.